Ladies and gentlemen, please welcome Senator Bernie Sanders.
Well, thank you all very much. Love you too. And let me thank all of you for coming out this afternoon and standing up for justice, for standing up for decency, and standing up for dignity. And let me also thank you for being here to stand up for democracy and to demand that we have a government that represents all of us, not just the 1%. And I want to thank the organizations who have helped us put on this event. Mountaineers for Progress, thank you very much. I want to thank Credo and Our Revolution and MoveOn.org and Daily Kos as well. And also, and most importantly, I think I want to thank those people, and it took a whole lot of courage for them to do that, to come before you and to talk about their personal issues and their health care issues. And that's not easy. You know, we've got a lot of people in this room. This thing is being live streamed all over this country. I mean, it's not easy to come up before a group of people and talk about some of the most personal things in your life. So I want to thank Emily and Joel and Kelly and Rusty Williams for their willingness to come up here. And they understand in being here, and you understand, that they're not just talking about their own situations. They are talking about millions of other Americans, people in West Virginia and Pennsylvania, all over this country, Vermont, who have the exact same problems. So I thank them for having the guts to get up here and talk about the reality of their lives and what this terrible legislation will do to them and to millions of others. Now, I am more than aware that Donald Trump did very well in the state of West Virginia. I got that. But what I want to say is that during his campaign here in West Virginia, in my state of Vermont, Pennsylvania, all across this country, Donald Trump told the people that he was going to be a champion of the working class, that he was going to stand up and take on the establishment because he understood the pain that millions of people in this state, in my state, and all over this country were feeling. Well, what I have to tell you, and I'm sorry to have to tell you this, but I suspect most of you already know it, Donald Trump was not telling you the truth. The so-called, and I use the word so-called intentionally, health care bill passed in the House several months ago, strongly supported by President Trump, is the most anti-working class legislation ever passed in the modern history of our country. And the Senate bill, also supported by Trump, in some respects is even worse. At a time when working families in this state, in my state, and throughout this country are struggling to put bread on the table, struggling to make ends meet, this legislation will cause massive harm to millions of our families from one end of this country to the other, and we are here today to say we're going to do everything possible to make sure this legislation never passes. We are gathered here today to make a very, very simple point. And what we are saying as clearly as we can is that we will not allow 22 million Americans to be thrown off the health insurance they currently have in order to give over $500 billion in tax breaks to the wealthiest 2%, to the drug companies, and to the insurance companies. Plain and simply stated, this legislation is not a health care bill. What it amounts to is a massive transfer of wealth from the working class of this country to the wealthiest people in America. While there are massive cuts to Medicaid in this bill, while seniors in West Virginia, Vermont, and all across this country will pay significantly higher premiums for the health care that they need, while Planned Parenthood will be defunded, the 400 highest income taxpayers in our country, most of whom are billionaires, will get about $33 billion in tax cuts. At a time when the middle class of our country continues to shrink, and when people in this state, in my state, and states all across this country are working longer hours for lower wages, are working desperately to pay the rent, to pay for the electric bill, to put gas in the car, we will not support legislation which cuts health care from people in this country who need it the most to give tax breaks to the people who need it the least. That, brothers and sisters, is not what this country is supposed to be about. And let me say a few words to my colleague, someone who I've known for many, many years, Shelley Moore Capito. Senator Capito, in America, we are not supposed to be taking from the most vulnerable people in our country, from the children, from the elderly, from the disabled, from the sick and the poor, in order to give massive tax breaks to billionaires. This is a deeply immoral piece of legislation. And I urge Senator Capito, please join your fellow West Virginia Senator, Joe Manchin, and vote no when this bill comes up before the Senate. It is no secret that the Republican leadership is scrambling to get the 50 votes they need out of the 52 Republican members who are in the Senate. And they are scrambling because the more that the American people learn about this horrific piece of legislation, the harder it will be for anybody to vote for it. And where we are today is that if 3 Republican senators, only 3, vote no, this bill is dead. And my strong belief is that if Senator Capito votes no on this legislation, it will make all of the difference, and this bill will die. Now, not only is this bill a disaster for West Virginia, for my state, and for the entire country, but the secretive, backroom process by which it has been written is unprecedented and literally beyond belief. Now, this bill, as all of you know, impacts about 1/6 of our economy, over $3 trillion each and every year. And this legislation literally touches the lives of every single American. Yet the discussions and negotiations on this legislation, which I am sure are taking place in Washington right now, have never been made public. Everything about this legislation has been done behind closed doors. Now, I want you to think about it and to appreciate how crazy this is. There have been no doctors, no nurses, no hospital administrators, no representatives of senior citizen groups, no one who is knowledgeable about the opioid crisis who has testified about the impact that this legislation will have on the people of our country. How can you draft a bill of such enormous magnitude without hearing one public comment from the experts in our country who are most knowledgeable about health care? That is an absolute disgrace. I'm a member of the Health, Education, Labor, and Pension Committee, the committee that has responsibility for health care. We have not heard one word about this legislation, and that is not acceptable. Now, it is un-American. You know, we can disagree on legislation, but the American people have a right to know what is in that legislation. Now, we may not know what's in the legislation. We may not know about how the deliberations are going on, but we do know one thing, and that is the Republican Senate leader, Mitch McConnell, is now trying to make deal after deal with this senator or that senator in order to get the 50 votes that he needs. And I say again to Senator Capito, please do not fall for that old trick. This legislation is fatally flawed, and no small tweak here or there will undo the massive damage that this legislation will do to our country. And further, I say to Senator Capito, if you do not believe what I am saying in terms of how bad this legislation is, listen to virtually every major healthcare organization in this country, all of which oppose this terrible bill. Listen to the AARP, the largest senior group in America, who understands that this bill will be a disaster for seniors and for older workers. Listen to the American Medical Association, a conservative group of doctors who understand that they will not be able to do their work effectively if this bill is passed. Listen to the American Hospital Association, who worries that many, many rural hospitals in areas where we need them the most will be shut down if this legislation is passed. Listen to the American Cancer Society, the American Heart Association, the American Academy of Family Physicians, the American Academy of Pediatrics, the American Psychiatric Association, the Federation of American Hospitals, the Catholic Health Association, the American Lung Association, the Cystic Fibrosis Foundation, the March of Dimes, the National MS Society, and the American Nurses Association. All of these groups oppose this legislation. So I say to my friend Senator Capito, I say to Senator Capito, when all of these groups, virtually every major health care organization in this country opposes this legislation, this is legislation that should not pass. Now, all of you know that several months ago, with the strong support of President Trump, the House passed their disastrous health care bill. While the Senate bill is very similar, let me very briefly describe to you some of what the House bill actually does. Now, one of the concerns that I have is that, according to polls, about half of the American people do not know what's in this legislation. And our job is to get the word out to all of our friends and all of our neighbors, because the more that people learn about this legislation, the less support it will have. Now, what the House bill does is it says that at a time when 28 million people in our country today, before this legislation, 28 million have no health insurance, and millions more are underinsured with high deductibles and high co-payments, that bill, the House bill, would throw 23 million Americans off of the health insurance they currently have, including 122,000 right here in West Virginia. That would bring the number of uninsured in our country to over 50 million people. In other words, instead of moving in the direction of providing health care to all, this bill almost doubles the number of uninsured in America. That is unacceptable. Now, everybody knows that the Affordable Care Act is far from perfect. Our job now is to improve it, not destroy it. Instead of throwing 23 million Americans off of health insurance, we should be fighting to join the rest of the industrialized world and guarantee health care to every man, woman, and child as a right, not a privilege. I would like very much for each and every person here to think for a moment about the human implications of this bill and what it would mean to you, your child, or your parent if they lose the health care that they currently have. I want you to think about it for a moment. What does it mean? Just think about it. What does it mean if today you are suffering with cancer? We heard from Rusty. What does it mean if you are suffering with heart disease, with diabetes, and suddenly you find yourself with no health insurance? You had health insurance, but because of this legislation, that health insurance disappeared. What happens to you if you have cancer, heart disease, diabetes, or any other life-threatening illness, and you cannot afford to go to the doctor when you have to? What happens if you have a heart attack or a stroke and you have no health insurance? And the horrible and unspeakable answer, and we have got to be honest about that, is that if this legislation were to pass, many thousands of our fellow Americans would die, and many more would suffer and become much sicker than they should. Now, that is not Bernie Sanders talking. That is what study after study after study shows. Several weeks ago, after I made that point, the point that I just made to you, on a television show, I was criticized by Republicans and by right-wing critics. And they thought, oh, Bernie Sanders isn't a hyperbola, talking about people dying. He's exaggerating how terrible it is for him to frighten the American people. Well, PolitiFact, a nonpartisan group that checks out what public officials say, took a look, in response to my statement, took a look at over a dozen different studies on the issue of mortality rates, whether people live or die, and lack of health insurance, and concluded that what I said was exactly right. Now, obviously, nobody can predict exactly how many people will die if they lose their health coverage. Nobody can make that prediction. But what experts at the Harvard School of Public Health estimate is that if 23 million Americans are thrown off of health insurance, which is what the House bill does, the Senate has 22 million people thrown off, up to 28,000 people every single year could die as a result of that legislation, and that is 9 times more than the tragic losses we suffered on 9/11 each and every year. In the wealthiest country in the history of the world, thousands of people should not be dying every year unnecessarily. And let me briefly tell you what happens when you cut Medicaid by over $800 billion nationwide over a 10-year period, and you cut Medicaid by $12 billion here in West Virginia. $12 billion over a 10-year period here in West Virginia. What it means is that if you are a child with a severe disability, you will no longer get the health care that you need to adequately function. An estimated 11 million children, or 15% of all kids in the United States, have special health care needs. They may have conditions such as Down syndrome, cerebral palsy, muscular dystrophy, or autism. They may have mental health needs such as depression or anxiety or complications from premature birth. Today, Medicaid and CHIP, the Children's Health Insurance Program, cover 5 million or 44% of these children, providing them with coverage so that they can live with dignity and security. Right here in West Virginia, Medicaid and CHIP cover 47% of children with special needs. 47%. Medicaid helps these children, and sometimes people aren't aware of this. Medicaid helps these kids get special education at school, long-term care, personal assistance from nurses, and I want to thank all of the nurses here who do the great work that they do. And I want you to think about it. I want you to think about it because our Republican colleagues don't want you to think about it. I want you to think about what it means if Medicaid undergoes massive cuts. What happens to those children with special needs? And the truth is that given the fact that nearly 75% of children with special needs come from low-income or middle-class family, many of those kids are going to be left out there on their own without any outside support. I want you to think about what that means to the future of those children's lives. But it's not just the children. What about the entire family? Right now, if you're a mom or a dad or a family with a kid with special needs, you can go to work. You can earn a living knowing that your child is taken care of. But if that care ceases to exist and you have to stay home with your kid and you can't go to work or you work fewer hours, your family will be plunged into economic crisis. Now, what kind of country are we when you have a majority of the House and you have many members of the Senate who think that it is appropriate to cut funding for disabled children in this country to give tax breaks to billionaires? That's not the America we believe in. But it is not just the children who will suffer if this bill is passed. It is the elderly. What every person in West Virginia and America should understand is that Medicaid now pays for over 2/3 of all nursing home care in this country. Nobody knows that. Over 2/3 of nursing home care. So what happens to the 7,000 seniors and persons with disability in West Virginia who have today are receiving their nursing home coverage paid by Medicaid? Who will pay for their care if Medicaid is slashed? How many seniors now in nursing homes will get thrown out on the street or be forced to live in their children's basements? How many middle-class and working-class families will now have to choose between whether they take care of their parents or whether they're able to send their kids to college? This is America. People should not have to make that choice. But it is not just, but for older people, it is not just nursing home care that is going to be decimated by this legislation. If you are a worker today in Morgantown who is 60 years of age and you make $40,000 a year, your average health insurance premiums will go up from about $4,000 a year now to nearly $8,000 per year under the Republican plan. At a time when half of Americans 55 and older have no retirement savings, this could cause disastrous harm for millions of people who have worked their entire lives. People have worked their entire lives, they put a few bucks in the bank, and now they're going to see their health care premiums almost double. That is not the way you treat people who have worked their entire lives. But once again, this is not my opinion. This is not Bernie Sanders talking. I want you to hear what the AARP, the largest senior group in America, says. This is a recent statement they made a few weeks ago. This is what they said, quote, "This new Senate bill was crafted in secrecy behind closed doors without a single hearing or open debate, and it shows. The Senate bill would hit millions of Americans with higher costs and result in less coverage for them. AARP is adamantly opposed to the age tax, which would allow insurance companies to charge older Americans 5 times more for coverage than everyone else while reducing tax credits that help make insurance more affordable. That's not Bernie Sanders, that is the AARP. Now let me touch on another issue that is impacting my state of Vermont very severely. It is impacting the entire country, but it is probably impacting no state more severely than here in West Virginia. And I know that I don't have to tell anyone here about the massive and horrific opioid epidemic that is devastating communities all over this country. And again, I don't want you to think it is just West Virginia. A couple of years ago, Governor of the state of Vermont used his State of the State address to talk in Vermont about our opioid epidemic. The truth is that each and every day, more than 90 people die in America from an opioid overdose. Just talk to police officers and tell you that almost every day they're out trying to deal with people who have overdosed. Nearly 4,000 people begin abusing prescription painkillers, and almost 600 start using heroin each and every day. This is a frightening epidemic. Now, according to the Centers for Disease Control, West Virginia's drug overdose death rate is the highest in the nation, nearly 3 times the national average. In West Virginia, on average, 1 person died from drugs every 10 hours. In 2016, 85% of those deaths involved an opioid. According to a recent article in the Washington Post, quote, "Drugs are killing so many people in West Virginia that the state can't keep up with the funerals," end of quote. Now, at a time when this state is estimating that it has 150,000 residents with an opioid disorder and only 156 detox beds to serve them, clearly the resources available for treatment and prevention today are totally inadequate. And that is true for the nation as well. So in other words, here in West Virginia and in my state of Vermont, we don't have the facilities or the capabilities of dealing with this opioid epidemic that is sweeping the nation and killing so many people. What we're doing today is inadequate. What happens if this legislation is passed and Medicaid funding is slashed? And what we must understand is that Medicaid pays for about 45% of all addiction treatment in the state of West Virginia today, 45%. If you cut Medicaid by nearly $800 billion nationally, it will mean massive cuts here in West Virginia that will result in some 17,000 people not getting the treatment they desperately need to deal with this addiction. That is criminal. That is absurd. We cannot allow that to happen. As a nation which is dealing with this crisis from coast to coast, our job is to come up with a comprehensive program to expand treatment and prevention, not to throw hundreds of thousands of people off of the treatment they currently have. Now, you know, a lot of my Republican friends, they talk about choice. They want the people in America to have all the choices they can, go to whatever insurance company you want and so forth and so on. Well, turns out that 2.5 million women in this country have chosen Planned Parenthood as where they want to get their health care. And this legislation would defund Planned Parenthood and take that choice away from 2.5 million women. And what this means is here in West Virginia, the Planned Parenthood Health Center in Vienna could be forced to close, leaving nearly 900 patients without the care they desperately need. Is exactly correct. It is unacceptable. Let me, as the United States Senator, I get emails and phone calls and letters from people all over my state, but also all over the country. What I want to do is take a moment to, again, humanize, put a human face on what this legislation would do. So let me just read, if you'll allow me, a few of the letters that I have recently received. Here is a letter that came from a mother who wrote, very simply, simple statement. She said, quote, "My adult son has Down's syndrome. He can barely get by with what few Medicaid services are available now. Please don't punish my son for needing these services," end of quote. And here's an email I got from a father, and he writes, quote, "Trumpcare will allow insurance companies to deny health insurance to people with pre-existing conditions. In my family, this could disqualify my son, born with a defective heart valve, who must have costly open heart transplant surgery to get a new valve every 10 to 14 years. Another letter. I am 38 years of age. I'm well educated and had a great job. But I developed chronic migraine. I am so disabled I can no longer work. I just qualified for Medicaid. It will be my lifeline as I fight daily pain and other debilitating symptoms. If the bill passes, I fear that it will become a choice between draining my family's financial resources, even facing bankruptcy, so that I can continue to access the limited medical treatments I have that help my condition." Another letter, quote, "I am a psychologist. Most of my patients, many of them dealing with the experiences of autism, trauma, eating disorders, and/or anxiety, can only receive services because they are covered by health insurance. This disastrous bill could allow insurance companies to deny coverage for mental health diagnoses, making it very difficult for the bulk of my patients to access services." Now, what is very interesting about the politics of what's going on right now is that, as you may know, this legislation in the Senate is widely, widely opposed by the American people. Poll after poll shows that the American people do not want this legislation passed. According to the latest USA Today Suffolk University poll, just 12% of the American people support the Senate Republican plan. 12%. As a matter of fact, according to a recent report, this legislation is the most unpopular piece of legislation ever to hit the Senate floor in the last 30 years. It is even more unpopular, if you can believe it, than the Wall Street bailout. Now, why is it, and I want you to think about this for a moment, why is it that if the vast majority of the American people oppose this legislation, why is it being aggressively pushed? How does that happen? The American people say no, and the answer goes to something even deeper than this legislation and the overall health care crisis that we face as a nation. The answer as to why this legislation is being pushed is that increasingly government does not respond to the needs of ordinary Americans and does not care about the needs of ordinary Americans. Especially since the passage of the disastrous Citizens United Supreme Court decision. What Congress does is pay attention not to working people, not to the elderly, not to the sick, but to wealthy campaign contributors. Congress responds to the needs of the billionaire class, and it responds to the needs of multinational corporations and their paid lobbyists. Yes, the American people overwhelmingly do not want this legislation. Yes, this legislation will be a disaster for the people of West Virginia, but that is, in terms of Congress, not what is important. What is important is that the billionaire class and campaign contributions want this legislation. They are more interested in the tax breaks, the large tax breaks that they will receive, than they are about whether disabled kids get thrown off of health insurance or whether seniors see a doubling of their premiums. Our job today, at a time when the richest people are becoming richer, while almost everyone else is becoming poorer, is to tell the United States Congress to begin listening to ordinary Americans and not just the 1%. In my view, our job today is to do everything possible to defeat this terrible legislation which will harm so many people. Our job tomorrow is to join every other major country on earth and guarantee health care is a right through a Medicare for all single-payer program. And our job, and what today is about, our job every single day is to continue the fight for a political revolution so that the day comes sooner than later when we have a government that listens to the needs of the elderly and the children and the sick and the poor and not just wealthy campaign contributors. Brothers and sisters, the Senate bill is a moral outrage, and together we are going to defeat it. Thank you very much.